So in Dallas, I see a lot of this, and using mono threads in this very simple procedure, and it works. Actually, it works quite effectively. And this, by the way, this is Paige. This is Paige, our model. Thanks for coming today, Paige. Paige has actually had this done before, not too long ago, about 6 weeks ago. And when we chatted a couple of minutes ago to try to determine what we were going to do and how she responded to the initial mono threading about 6 weeks ago, she said, "Well, I really haven't seen anything yet, and I think it's still early. And if I did threads on her about 4 or 6 weeks ago, today this is a great opportunity, in my opinion, to do microneedling and fractional RF, and use a biologic. So we want to, when we're dealing with improving or in aesthetics, we have those layers of beauty. Michael refers to them in different ways. I always work on the most superficial part of the skin with microneedling, collagen induction, and then we get down to deeper layers of the threading underneath. There's a great synergy between the two. The nice thing about threading or with monos, okay, great. Threading with monos, if you well, first of all, if you put them in too deep, you're not going to get a real good benefit. If you put them in too shallow, as you know, we're going to see the thread and the patient's not going to be happy. So if you start, if you place the thread, you put the thread in place and you see it's too superficial, don't insert it all the way. Just take the needle out, keep the tail there, you can pull the thread right back out. So you can, it's easily reversible if you don't put put the thread in all the way. So I'm just going to kind of lay out some boundaries where we're going to focus on today. Her lines are actually vertical, and they're between these two. So I'm out here. Her lines that she does, wants to work with and improve are between these two lines. So I'll always lay out. I'll always take the thread itself and determine where I want to lay it out and where I'm going to start, where it's going to end up. You can cross hatch this, you can stack it, vertically, and that's what I'm going to do today. I'm just going to do some vertical from top to bottom. Often we get these lines and marks extend into the between the breast, and that gets a difficult area to insert needles, to insert threads there. You don't have that problem, so we're going to be 1, 2, 3. Okay, we're probably going to do about. So we're just going to insert threads this way. This is probably the easiest procedure that you can do. Okay. Okay, I put the numbing cream on, okay? All right, good. And I'm just going to start one right here. Little pinch. So, honestly, the angle that you start at is extremely important. If you're where you're set up with that patient, if you're too low, your angle's going to be off. If you're too high, your angle's going to be off, and it makes it a whole lot easier if you just really customize your exam table or your procedure table. I leave these in for hemostasis. What I'll also do is I'll twist them a few times. There's a lot of different protocols out there. Twist them a few times. I'll twist them 5 or 6 times, and then I'll pull the thread out. That'll create a little volume, and then we're at a level where we're going to create collagen induction over time. And I always leave the threads in, obviously, so I know where they are. It's about a centimeter, as close as I can get them, given my... How you doing, hon? Good. Pretty easy, eh?
Mm-hmm. I'm going to cover tomorrow objectives for collagen production. quantum physics. You're exactly right.
Yep. Yeah, I think it's the no pinch. You doing okay? Any discomfort? Not really, right? Okay. Okay, my dear, we're almost done.
And that skin's pretty thick, isn't it?
27 is the gauge, 50 is the millimeter depth, length?
Yeah.
Okay.
Yeah,
It's about 2 inches.
and we were talking about how to convert millimeters and inches because there's some. We won't need to do that because we're using Miracle, so we're just going with millimeters. But okay.
Pricey, it's converted for you.
And again, you're spinning them
I am.
both clockwise and counterclockwise? Or
I just spin them clockwise.
Okay.
I'm not counting. I just spin them for, probably 5 to 10 times and then take them out.
And so that is a quantum physics entity also.
It is, absolutely, yeah.
Because of the electrons.
And it is a thread at the end of the day, so I'm thinking distal further out,
Yeah.
you're not going to get that torque and spin as much as you would. I don't know.
No, I don't think so. I think it transfers over. I mean, I think it
It's a corkscrew, so it should go all the way to the end. But
Yeah,
you get
I would think.
information at the point
You
where
okay?
put it in.
Just move it so you can get to it.
Yeah, thank you.
Oh, at one time.
Here we go.
Jackpot.
Do you feel anything, Paige? Even pressure? Just pressure from his fingers.
Okay, I mean, we could cross hatch it, but that's the, I
So
wanted
you
to,
would do a whole band of verticals as well?
yeah, I would probably cross hatch this, yeah. And then, and microneedling would be wonderful in this situation.